So the nerve supply of the face, which is having 13 sets of nerves on each side, and out of these 13 only one is motor, remaining all are sensory, which are coming from the fifth cranial nerve, trigeminal nerve, and only one is coming from the cervical plexus, the greater auricular nerve. Now we will move on the blood supply of the face, venous drainage, and finally the lymphatic drainage of the face. So mainly face is supplied by the facial nerve. The facial nerve is a branch of the facial artery. The facial artery is a branch of the external carotid artery. So again the face, and it is supplied mainly by the facial artery, which is a branch of the external carotid artery. This is the hyoid bone. We can feel our hyoid bone behind the mandible. At the level of the greater cornu of the hyoid bone. At the level of the greater cornu of the hyoid bone is having two pairs of cornues, the greater and the lesser cornues. So at the level of greater cornu of the hyoid bone, there is origin of the facial artery. After dipping inside the submandibular gland and taking a curve, so after taking a angular curve in the submandibular gland, the facial artery is coming outside after taking a sharp turn behind the submandibular gland and entering in the face, from the antero-inferior angle of the masseter muscle. At this level, the facial vein is behind the artery, and mandibular marginal nerve, a branch of the mandibular division of trigeminal. So this is branch of facial. So mandibular marginal nerve, which is a motor nerve, and branch of facial nerve is anterior to the facial artery, and facial vein is behind that. So I will draw the facial vein here. So vein is behind this. This facial vein will join the anterior region of the retromandibular vein to form the common facial vein, and mandibular marginal branch of facial artery of facial nerve is anterior to this. So from here it is ascending upwards. Here it will give a named artery. It is giving 3 named arteries and many unnamed arteries. One more is here and the final is here. So it ascends upward and forward, lying 1.25 centimeter lateral to angle of the mouth. Below the angle of mouth, it is giving inferior labial artery. So this is the inferior labial artery. And this is the superior one. So superior labial artery. The superior labial artery is giving here the labial branch, the septal branch for the nasal septum, and the alar branch. So 3 branches of the labial artery can be seen here. 3 branches of superior labial artery: the labial proper, the septal branch, and the alar branch of the labial artery. So here we can see more clearly these 3 arteries. This is the labial branch, which will supply blood to upper lip, the part of face between the lower part of the nose and the part of upper part of the upper lip. This is the septal branch, which will supply blood to the nasal septum. So this is labial proper, labial, the septal, and the alar. Alar branch is supplying blood to the lateral part of the nose and the cheek. Here the artery is anastomoting with the dorsal nasal branch of the ophthalmic artery. Dorsal nasal branch of the ophthalmic artery. So this is the termination of the facial artery near the angle of the eye and the root of the nose. So terminating after anastomoting with the dorsal nasal branch of the ophthalmic artery. One more artery which is coming from this side, running between the pituitary duct and the zygomatic arch. This is the transverse facial artery. The transverse facial artery. The transverse facial artery is a branch of the superficial temporal artery, which is a smaller terminal branch of the external carotid artery. The facial artery is also known as external maxillary artery. So this is the facial artery. Also known as external maxillary artery. The transverse facial artery, which is arising from the superficial temporal branch of the external carotid artery, is taking its origin from the temporal region, running forward between the zygomatic arch and the parotid duct and supplying the blood to the part of the parotid, part of the masseter and some part of the buccinator. So these are two arteries supplying blood to the face. Some other small arteries which are running with the branches of the ophthalmic nerve. Some small arteries which are running with the branches of the trigeminal ophthalmic nerve, that is supratrochlear, the supraorbital lacrimal, are also supplying blood to the face. Now we will see the lymphatic drainage of the face. Then first we will see the venous drainage, then we will move on the lymphatic drainage of the face. So W shaped arrangement of the veins. So in the face there is W like arrangement of the veins. The supraorbital, the supratrochlear and supraorbital veins are uniting to form the angular vein. So this is the angular vein. Angular vein is descending downwards and laterally, and also receiving the deep facial vein. It is coming from the pterygoid venous plexus. So deep facial vein and this is the pterygoid venous plexus, and this is connected to the cavernous sinus. So these are emissary veins connecting the pterygoid venous plexus to the cavernous sinus. This is the pterygoid venous plexus. So deep facial vein joining the angular vein to form the facial vein. This is facial vein proper. And here, this is the maxillary vein and superficial temporal vein. These two veins are uniting or joining each other to form the retromandibular vein. The mandibular vein. After formation of the retromandibular vein, it is again bifurcating to form its anterior division and the posterior division. So this is the anterior division, this is the posterior division of the retromandibular vein. Now this facial vein and this anterior division of the retromandibular vein are joining each other to form the common facial vein. The common facial vein. This common facial vein will descend downward and it is draining in the internal jugular vein. So common facial vein is finally draining its blood in the internal jugular vein. And here we can see the posterior auricular vein. So this is the posterior auricular vein. This posterior auricular vein is joining the posterior division of the retromandibular vein to form the external jugular vein. External jugular vein. It is running in the posterior triangle across the sternocleidomastoid muscle, and in the anterior inferior angle of the posterior triangle it is piercing the investing layer of the deep fascia of the neck, and finally it is draining in the subclavian vein. So draining in subclavian vein, and this is draining in the internal jugular vein. So W-shaped arrangement of the venous drainage of the fish. W-shaped venous arrangement of the venous drainage of the face. So we have seen the venous drainage of the face. Finally, we will see the lymphatic drainage of the face. Here I will draw the diagram for the venous drainage. So venous drainage of the face is mainly in pre-auricular or parotid lymph nodes. The forehead, the lateral part of upper and lower eyelids, the conjunctiva, and the orbit, the part of cheek, the part of temple, all are draining in the pre-auricular or parotid. These are pre-auricular or the parotid lymph nodes. So these are the pre-auricular or parotid lymph nodes. This part is receiving lymph from the medial side of the eyelids, the nose, all are draining in the submandibular lymph nodes. and this remaining part of lower lip and chin are draining in the submental. Or we can simply say the mental, mandibular and the preauricular or the parotid lymph nodes. So this was the blood supply, the venous drainage and the lymphatic drainage of the face. Now we will move on the lecture on eyelid after a short break.